Myrtle's Detox and Wellness Spa here today with you, and we're going to be talking about diabetes. Now, this information that I'm bringing to you was given to us in a research project that's done at University of Illinois at Chicago. Okay, and that was back in the early 2000s. Now, today I'm going to be talking to you about the human body, how diabetes affects the body. Okay, so we're going to start from, before I start there, let me just tell you what is diabetes. Diabetes is actually a disease that affects the body and organs of the body as a result. For example, the brain. Now, it affects the brain indirectly because it damages blood vessels that send messages or carry blood and oxygen to the brain. And because this happens, it puts the brain at risk for getting a stroke or what's called a cardiovascular accident, CVA. Then it also affects the nerves. Some people complain about nerve pain. It's called diabetic neuropathy, nerve damage. Some of the patients describe this as a tingling, a burning, a painful sensation in the feet and the hands, like the extremities. Okay, you can also get blindness because of the damage to the nerves, the optic nerve, the nerve to the back of the eye as well. So there you go for the brain and the eyes that can be damaged, and the nerves. Then we go on to the cardiovascular system, which is the heart. Because these tiny blood vessels are damaged that usually carry blood and oxygen to the heart is not getting the blood flow that it needs. And thus, it puts the heart at risk for catching or for getting a heart attack, what you would call an infarction or myocardial infarction. Diabetes also damages the arteries, okay? Arteries all over your body, and that's what causes these problems in the different organs or the different systems. The digestive system, for example, it starts from the mouth and it ends at the anus with some accessory organs in between that helps, such as the spleen and the liver and the gallbladder, etc. Now for the digestive system, the gums are prone to infection when you're diabetic. Thus, you would need periodic deep cleaning from your dentist to help to prevent the plaque buildup or the gum disease from creating loose teeth and losing your teeth overall. So it helps to prevent a gum infection. Then we have the stomach. Diabetes slows down the emptying of the stomach. So food that's supposed to take maybe 5 hours to come out of the stomach to go into the small intestine is now taking longer. The patient or the client is feeling full, bloated, not themselves, just don't feel right. That's because of the diabetic effects on the stomach. Then we go on to the urinary system, includes the bladder and the kidneys. The kidneys now are not being irrigated the way they should. And thus it causes damages in the arteries in the kidneys. And now you have what's called insufficiency. It's not enough, not sufficient. So you have kidney insufficiency, renal insufficiency. That's as a result of the damage to the blood vessels in the kidney. And then we have the bladder. Now, because of diabetes, the sensation in the bladder is decreased. Now, the person doesn't get to reach the bathroom as fast as they would have if they didn't have damage to the bladder vessels. So they have what's called frequency. You need to run to the bathroom, like need to go right now. Or they have incontinence. You end up wetting yourself when you shouldn't have. So that's damaged involuntary loss of urine. That's one of the problems with diabetes. Then we go on to the respiratory system, the lungs. The lungs also gets damaged because of the diabetes. And the person is more prone to pneumonia or to the flu. And even so, if they smoke, it makes it even more difficult for them to get the oxygen exchange in the lung and ward off infections. Now we have the musculoskeletal system. Just as the name says, the muscle and the skeletal system. Now, the skeletal system, when you're diabetic, it actually increases the risk of bone fracture, of getting fractures of the bone from the skeletal system. The muscles, on the other hand, helps to uptake the excess sugar in the body. So, but you have to exercise. When you exercise, this helps the uptake of the excess glucose and helps out the body. So these are some of the things that happens in the body when your glucose is high, when your sugar is high, when you're diabetic. So being diabetic does not sentence you to death, but it means you have to work hard in controlling your sugar, because when your sugar is out of control, it damages body organs. So there's our clip for today. Hopefully that this information was helpful. I'm going to be doing about 10 or more segments on diabetes, putting it up here because a lot of people have been asking me. And as you see my little apron in the back, it tells you the different body organs. It shows you the different body organs that we're going to be talking about, those that are directly affected by the elevated glucose in our bodies. So do like, share, subscribe, and put on that notification bell if you haven't done so yet, so you can receive future presentations. Do have a blessed day.